Hello everybody, today I'll be starting head and neck and our first topic will be scalp. So first of all, definition of scalp, it is soft tissue covering the cranial vault. Now we have the extent. Anteriorly, its extent is from supraorbital margin. Posteriorly, it extends up to external orbital protuberance and superior nuchal lines. On each side, there are superior temporal lines. So here you can see it is supraorbital margin. Okay, it extends from here up to external occipital protuberance. Okay, and on each side there is superior temporal line here and on the other side. So it's the extent of the scalp. Now next is layers of the scalp. There are 5 layers and a mnemonic is scalp. Okay, S for skin, C for connective tissue or superficial fascia, A for aponeurotic layer, L for loose areolar tissue and P for pericranium. I'll show you the diagram. Here you can see the diagram. First layer is skin with the hair. Second layer is superficial fascia, then epicranial aponeurosis, loose collective tissue and pericranium. And here you can see emissary veins communicating from the scalp to the superior sagittal sinus in the brain. Okay. So next is superficial temporal region. It has 6 layers, okay, same as that of scalp, just a little bit different. Okay, it has 6 layers: skin, superficial fascia, aponeurosis. These are the same layers as that of scalp. Okay, next layer is temporal fascia and temporal. Next is temporalis muscle. Okay, and then pericranium. So here are the layers of the superficial temporal region. Now we come to arterial supply of scalp and superficial temporal region. So it is divided into two parts, in front of auricle and behind the auricle. Okay, so basically the arterial supply of the scalp is from external and internal carotid. So let us see, in front of auricle there is supratrochlear and supraorbital and superior temporal arteries. The first two, supratrochlear and supraorbital, are branches of ophthalmic artery, which in turn is a branch of internal carotid. Okay, and superficial temporal artery is branch of external carotid. Then we have behind the auricle is posterior auricular and occipital arteries. These are branches of external carotid. Okay, I will show you the diagram. So here you can see supratrochlear artery, supraorbital artery and superficial temporal in front of the auricle. Okay, then behind the auricle, posterior auricular and occipital arteries. These three are the branches of external carotid and these two are branches of ophthalmic artery, which in turn is a branch of internal carotid artery. We have venous drainage. Venous drainage के लिए veins have similar names as that of arteries. It means there will be, and these veins accompany these arteries: supratrochlear vein, supraorbital vein, superficial temporal vein, posterior auricular vein, occipital vein. Okay, so here is the venous drainage: supraorbital, supratrochlear. Okay, posterior auricular, retromandibular vein is there. It has a branch, maxillary vein. Okay, then supraorbital and supratrochlear will join to form angular vein, which in turn forms facial vein, and there goes a branch, deep facial vein, which drains into cavernous sinus. Okay, then we have common facial vein, internal jugular and subclavian vein. We have lymphatic drainage. Anterior part of scalp is drained by preauricular or parietal lymph nodes, and posterior part by posterior auricular or mastoid and occipital lymph nodes. Okay, nervous supply, there are 10 nerves supplying the scalp and superficial temporal region. Here you can see the nerves. Okay, 10 nerves: supratrochlear, supraorbital, zygomatic-temporal, temporal branch of facial, auricular, temporal nerve. Now these are in front of the auricle. Out of these 1, 2, 3 and 4, these are sensory, and temporal branch of facial is motor. Okay, now behind the auricle there are four sensory and one will be motor. Okay, so posterior auricular nerve is motor, great auricular, lesser occipital, greater occipital, and third occipital are sensory. Okay, so this is all about the nervous supply. Okay, now we come to the applied part. So here, clinical anatomy. Wounds of scalp do not gap unless epicranial aponeurosis is divided transversely because of, now next is because of abundance of sebaceous cysts. Scalp is a common site for sebaceous cyst. I'm sorry, abundance of sebaceous glands. Okay. Next is wounds of scalp bleed profusely because the vessels are prevented from retracting by fibrous fascia. Next is bleeding can be arrested by applying pressure above the ears by tight cotton bandage against the bone.